Hello, everyone. Welcome to the Dr. Sophia ObGyn Podcast. I'm an ObGyn practicing for over 15 years in my native New York City, and I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone, and welcome to the Dr. Sophia ObGyn Podcast. As always, I am joined by my co-host, Touseef Mirza. And today, we are going to talk about something that happened to me related to perimenopause. It was so hard for me to actually accept that it was actually related to perimenopause. And so, it makes sense that we call this episode the crash and burn, because that's exactly how I felt. So, without further ado, let's get into it.
We just literally started to talk about our week like we usually do, and we ask each other how we're doing. And you basically said, girl, I hit a wall.
I more than hit a wall. I was going out of my mind.
Yes. And you're just like, I don't know what's going on. And so the more that we talked about it, we realized that this is a very apropos episode. It's an episode that I think people will relate to because it's part of the lived experience that some people might be going through. So in terms of just starting the conversation, let's just start about like how your week went. Like, let's say we started the conversation all over again. And about like a week ago or 4 days ago, I said, hi, Sophia, how are you doing? What's going on? And then what did you answer me?
I had a crazy week. I just felt like I was all over the place, so scatterbrained. I really could not focus. I could barely get my own work done. I couldn't sit down to do my notes. I couldn't sit down to focus on anything.
So this is not usually your MO. This is not usually how you function. Usually you're pretty sharp and you know what needs to be done, like clarity in your work.
Here's the thing. I think anybody who knows me as someone who's always into so many different things, kind of all at the same time. So I definitely would consider myself maybe a little hyperactive. Okay. My brain, I just always have a lot of different things going on, but it doesn't stop me from focusing on those individual things. I like to take on a lot of different tasks, but I can actually handle most of the time all those different tasks. So last week, it just didn't matter what I was doing. Like I had to get up. It didn't matter. I would sit down to do something. And then just moments later, I'd be like, oh, let me get up and use the bathroom. And then I'd come back. And then I'd be like, oh, let me go get something to eat. And then I'd come back. And then I'd be like, oh, let me go through my phone. Oh, I forgot to call somebody. Oh, I didn't write that note. Let me go back and write the note.
So it was just like all these different types of inputs happening, but you can't really focus on finishing one thing.
I could not finish a single thing. And I was like, oh my God, like, holy cow, like my ADD is on fire. And why? Like, what is the trigger? What is happening? It almost even felt kind of manic, like constantly high, you know, like on 10, but not really getting anything done or getting anywhere. And I was like, something's wrong. I know. I think I need some focus medication.
But it wasn't like something had happened in your life and all of a sudden there was a huge level of weight or anxiety that came out of nowhere. It was nothing
I didn't
had happened.
have any specific trigger. I didn't have any specific stressor or new thing that happened. To be fair, the only thing that happened was that I had my period. You know, oh my gosh, I'm saying this on live. I had my period. I'm telling everybody. Okay, no, seriously though.
And it wasn't PMS. It wasn't
like PMSing. If I feel PMS, I can literally say to everybody, okay, I'm going to be a little crabby today. And I feel it and I know what's happening. And it lasts probably for about 24 hours. And then the period comes and then I'm totally fine. But this was like a whole week of feeling completely out of my body. And I couldn't quite remember things. I felt completely unsharp. Like I was so foggy in my brain.
But you were telling me that wasn't when you were actually with somebody, with your patients. It was really when you had to focus specifically, like when you were looking at the computer or something like that.
Yes, definitely. Having like conversation and talking to people and being in with my patients and thinking about what's going on with them, no, that I could handle. But when I had to sit down to actually write their notes, to actually
So when you say
together
notes,
my thoughts,
okay.
Writing in their chart,
Got it.
documenting the conversation that we had and what their, plan is, etc. Or even if it wasn't that, let's say I needed to send emails out, or I couldn't do it. I could not do it. I had to do evaluations for my medical students, and that took me like half a day. I would start and I would stop. I would start and I would stop. And then I was thinking about it. And then like 2 seconds later, I'd be thinking about the patient. And then 2 seconds later, I'm thinking about my kids. And then 2 seconds later, I'm thinking about my house. And then I'm thinking about, did I talk to the accountant? Like it was out of my mind. Yeah, there was a moment where I felt like I wasn't functioning. But it's really with the administrative tasks that I had to do, that I had to go through, like charting or, the administrative stuff in terms of putting things into the computer and sitting, really focusing on what I was writing and doing. That's where I was having such a hard time really feeling like I was doing my job effectively. When it comes to actually talking to my patients, being with my patients, oh no, that part, I could do that all day.
Or the procedures or anything
procedures or, honestly, the concept of being an OBGYN, I feel like it's just so ingrained in me and in my blood. But the idea of sitting in front of a computer, that was more than I could handle. So I was talking to my friends and I was explaining how I was feeling. I was talking to my sister and it almost felt like I had like pressured speech. I'm telling you, it really felt like what we would sometimes think about as a mania kind of a feeling, except I think one of the major differences is that I was clearly aware that I was in it. Like I was aware that I was not myself. But
you just didn't know why.
I didn't know why. And it was that. And that actually was the biggest part of the frustration. I think when people sometimes may be in mania, their body and their behavior is in it, but they don't necessarily know or the awareness that they're in it.
I know that we talked and you told me that. And I said, well, maybe you need to run around or like have a punching bag and maybe you need to exert some energy. That's what I had to say. Maybe you have too much energy inside.
Like pent up, right?
Pent up energy that needs to be released because everything else seems to be pretty stable.
Right,
and
like I needed to just go
and
take a run or something,
yes,
right?
Just like blow
Girl,
some steam.
nothing was going to help me. I'm telling you, I was losing it. Okay? I mean, it was to the point where I was like, okay, no, I need to call it was a Sunday. I was talking to my sister and I was like, I need to call my therapist. Like, I need a conversation. We need to talk about this. We need to talk about why my ADD is on 10 and how I'm going to manage this on a Sunday morning. Like, I needed to talk to her right away. Okay. That's how anxious, frustrated, and unnerved I was by the way my body was behaving.
And you don't even talk to your therapist that much.
No, I sure don't. I surely don't. I mean, it's a relationship that I've had for many years, but it's kind of like a maintenance touch-in, we were at the point where we maybe talk sometimes even just only once a month, right? So the concept of this urgency of me needing to talk to her, and I did not have a new life event or stressor or thing. Granted, this was stressing me the hell out.
Right. If anything, your life is pretty stable.
Yes.
Yes.
Yes,
Yeah.
exactly. And so the thing that happened is that I said, okay, I need, at this point, I said some type of focus medication. Okay, that's where I was. And then I started talking to another couple of my friends and they were like, when's the last time you got your hormones? And I said, hormones, girl, that's not the problem. Are you listening to me? I'm not focused.
It's about my brain.
It's about my brain. And then you're like, no, I'm telling you, it's time for your pellets. Okay. And so here we go. Let's talk about what pellets are.
Okay, I'm just going to go even further back than that. Can you please tell your age?
Really?
You don't have to say the exact age.
I'm in my mid to late 40s, closer to 50 than 40. How about that?
Perfect. So that people understand, when does this type of stuff even happen?
Well, listen.
Listen, if we're going to put it all out, I think we already talked about age, but anywho, keep going.
You don't ask a woman her real age now. Come on.
I'm fine.
No, it's fine. I am a very young 46-year-old
You
woman.
are a vivacious woman who happens to be the age of
46.
fabulous.
Thank you.
Please continue.
Anyway, so I was not really prepared for them, my friends, to be like, girl, you need your pellets. You need your hormones. And I was like, my hormones, girl, I told you this is not the issue. And they're like, really? Because you sound like the people we treat all the time.
And these friends you're talking about, they're in the medical field?
Yes, these are the women that work with me, and we do special menopause and perimenopause treatments and hormone replacement for women. And that includes hormone replacement with things like testosterone, not just estrogen and progesterone. And we also do thyroid. It's a lot more than just estrogen, for example. And actually, I have been on hormone replacement for some years now, starting only with testosterone, because my life kind of needed it. I am pretty high functioning and I have all of these different things happening all the time. And testosterone is essential for our vitality, our sense of energy. And it's really made a difference for me. When they said, you need your hormones, and even more importantly, that's when I even had to think about it. Yeah, I even may need a little estrogen. Though I wasn't experiencing hot flashes in the same way that, the things that we typically associate perimenopause, menopause with, the hot flashes, the real irritability. I wasn't irritable. I was just irritated with myself, not necessarily with other people. I wasn't screaming at, just being really short with people or anything like that. But for myself, I just was like, what the heck is going on? What is happening?
All right, so we're going to pause here for a second, and we're just going to describe what is perimenopause.
So perimenopause is the time that happens before you go through the full 12 months of no period, called menopause. You go through 12 consecutive months without menses, and we consider that time after that as menopause. Perimenopause is anywhere from 5 to 10 to up to 15 years before you have that final period.
And that's usually women is around 52 when they...
So menopause itself, the average age of menopause is about 51 in this country. And so for sure, a woman who's in her early 40s can be experiencing perimenopause, or those symptoms such as hot flashes, night sweats, insomnia, changes in their body like joint pain, decreases in libido,
brain fog,
memory changes, definitely energy changes in their hair, changes in their skin, changes in their gut. I mean, just the number of changes that your body goes through leading up to and even after menopause are tremendous. And everybody doesn't go through it the same way. So you can have one symptom, you can have 3 symptoms, you can have 5 symptoms, you can have some symptoms at one point, others at another point. And it hit me like a ton of bricks that what I was feeling going on in my brain and in my body and how I was experiencing it, that sense of anxiety of kind of losing it, of not being as sharp, of not being able to function, was a symptom of perimenopause.
Before I ask you more questions about your perimenopause, the changes that happen in perimenopause throughout up until menopause and beyond that, those are related to changes in our hormones.
Yes. Perimenopause, menopause, definitely understand that it is a hormonal transition that our bodies are going through. And perimenopause is this constant, I like to call it like a yo-yo. It's like up and down, up and down, up and down in terms of the hormones. They can be high, they can be low, they can be flat, they can be high again and low. It's like this constant, like upside down time period where you can still be getting a regular period every month, and yet you're experiencing all of these symptoms. And outside of that, you can be experiencing changes in your period as well. Your periods can be longer, they can be shorter, they can be heavier, they can be lighter, they can be more painful, they can show up anytime. And that in and of itself can also make women feel very out of body because they don't know what to expect. Their periods have changed and they don't know why it's changing. And, you know, for some of us, it seems like, okay, do we need to eat different? Do we need to exercise more?
Yeah,
Do
we think that we're doing something different, right? We're thinking it's something that we're doing that's causing potentially these different changes. Meanwhile, our body is doing what it needs to do regardless.
Has nothing. Yes. I mean, obviously, the way we eat, our lifestyle is going to have a tremendous impact on how we go through this transition. And there are things we can do to kind of help our bodies along throughout the transition so that it becomes certainly more tolerable, certainly more manageable. I don't even want to say tolerable, but rather manageable, right? And those things, those options include our nutrition, include how we exercise, include hormone replacement should we want it. It includes our relationships. It includes things like if we need to, even having a therapist, but there's no one answer, right? All I know is that for me, it made me realize this concept. I tell people all the time, when women are going through this perimenopause transition, you can see 5 different doctors before they figured out that it's perimenopause. Because I know for myself, a week and a half ago, I thought I needed to see a psychiatrist because I thought I needed somebody to prescribe me some Adderall. And that was totally not what I needed. Okay. And I am a doctor who treats women all the time, every day for perimenopause and menopause. And still yet I had this episode and it just blew my mind. It's like this response that I had, it made me clearly understand how my patients feel. Because it's like, well, how did I go from last week to this week? Like I was totally fine and I'm totally not fine now. This can't it's gotta be something else.
You know, something has changed, but it doesn't click that it can have this level of effect this early.
The intensity of the change from one day to the next, the way the brain changes in this transition, though I can speak to my patients and say, have more grace with yourself, accept and understand that we're going through this change, and then to figure out how we're going to go through that change in a way that is manageable. And like I said, whether that's through exercise, because we're going to release some endorphins, whether that's through how we're changing our diet and eating more clean and more anti-inflammatory, etc., and including hormones if we want to. But I had never experienced it. I saw it in my patients and I had empathy for my patients. Now I am my patient and it still hit me like a ton of bricks.
This is why we really needed to do this, because you're an OBGYN. And by the way, I'm so grateful to you wanting to be so honest about this. We think of perimenopause of, little things here and there, but we don't really understand the level of impact that it has, the level of the effect that it has. And so therefore we're just like, well, maybe this is not perimenopause. It has to be something else. Like in my mind, I didn't even know a lot about perimenopause. I might have had a couple of sweaty nights here and there, but I was like, come see, come sa, it's okay, it'll pass. But I didn't fully, I guess, appreciate the different types of effects that it has. We focus on the effect, which was for you in terms of you couldn't focus. And a lot of times, especially, I'm not going to generalize, but a lot of times when we look in the medical field, we have a tendency to look at the effect versus really trying to dig deep and trying to understand the source of it. And we're trying to really address just the symptom and not the source. And so sometimes it can be really misdiagnosed. Would you agree with that?
I know that perimenopause is misdiagnosed left, right, and center. I know that for a full fact. But I think you bring up the point of impact. I could not even work effectively. I could smooth it over, right? Except that I have 20 charts now that I need to go back and sit through and type up, etc. But it was affecting me in my work. It was affecting how I was living my life. I have other very important tasks, not just in my job, for my kids, for my house, paying my bills, that I literally could not sit through and focus on. And I had it for a week. I had it because I was just like, no, I have got to take care of this. What is it right now? I need to know. And I can only imagine those women who are going through this. They have to either take time off from work or they're going to work and they're just not able to actually function at work, and how other things like the actual mood changes and irritability, the emotional part, the other things that are coming with the frustration that you're feeling inside of yourself. And I'm telling you, hats off to every woman who's going through this, because there is nothing about this that is easy. And we have to band together to not just understand where we are in this life transition, but to really have empathy for each other and create a space where we can have this experience and talk about it so that we can then be clear on how we can manage it.
And also that we're not crazy.
We are not crazy. I felt crazy.
You felt crazy, but you are not crazy.
But I'm 100% not crazy. I know I'm not crazy.
Yes. The body is just doing what it needs to do right now, and the effect of it is that, but it doesn't mean you're nuts.
And let me tell you what was more funny is the fact that when my friends were like, hello, get yourself together and get your hormones.
And then were you skeptical when they said that? Or did you say, oh, right, how did I miss this? Like, what was your reaction?
I felt both ways.
Okay.
I really did. I felt like, what are they talking about? They don't even know what they're talking about. That can't be it. Did they hear me? Last week I was fine. This week I'm not fine. No, that's not the issue. And then I was like, that might actually be the issue. Damn it.
So then what did you do?
I got my hormones. What did I do? I got my hormones.
So what does that mean, you got your hormones?
So for me, hormone replacement looks like pellet therapy.
So HRT.
HRT, hormone replacement therapy. And for me, I do a replacement both of testosterone and a little bit of estrogen. And
this is based on your hormonal profile.
This is based on my own personal hormone profile. And it's also based on my own, like how I feel. And I already have progesterone. So all three of those things are being replaced. And I was like frustrated and relieved at the same time. I was like, oh, thank God. Okay, so I'm going to be fine. And literally just within days of going back, making sure I did my hormones, I felt like night and day. I started to be calm. I started to be able to focus. I started to be able to do my work. I started to have normal conversation.
Because we've rebalanced the hormones at a level that they're supposed to be.
That is correct.
And the form in which you took the hormone replacement is in what form?
So it's called pellet therapy, the one that I do, bioidentical hormone pellet therapy. And that is a small implant that goes just underneath the skin in the fatty tissue. And the reason why I like it particularly is that it kind of is released in my body in a very steady state kind of way. So it kind of will bring the hormone levels up to a certain level and then kind of stay that way and coast. And it slowly dissolves over time. It works for me. It works for my lifestyle. It's not the only method or way for women to have hormone replacement. As a matter of fact, it's probably not the most common way necessarily, but it's definitely an option. Hormone replacement can be via patches, via creams, via pills. So there are very many different ways of doing hormone replacement, but that's the way that works for me.
Okay. And so you took it and literally within
Days.
So what happened within days?
And it was so funny. A few days later, and I was just like, I recognized the calm. I recognized I was just doing work, actually.
That you were inputting stuff and it actually flowed?
Yeah, I was just doing work. I was responding to my emails. I felt almost like I could remember things more. And then I realized, wow, I really just needed my hormones. I feel so much better.
Because by rebalancing the hormones, then your brain functionality could work the way it's supposed to, because
Yes.
it's functioning normally.
Yes, I had to remember that, for example, there are 400 functions in the body for estrogen. And
Can we say that again, please?
yes, estrogen, 400 functions in the body and the brain.
This is so important because I think when we think about estrogen, we think about the uterus, we think about the vagina, we think about the reproductive system, but we don't really understand that it has so many other functions.
On your skin, on your brain, on your heart, on your bones. I mean, it's vast.
And therefore, if the estrogen is out of balance, it affects all of those
things.
areas that
Yes.
you
Yes.
just named.
Testosterone, an incredible hormone for calm.
It's not just for men.
It's definitely not just for men. We actually, as women, have a higher ratio of testosterone even to estrogen, technically.
And men have estrogen.
And men have estrogen too. Their predominant hormone definitely is testosterone. But yes, men definitely have estrogen too, for the same reasons we do. Because it can affect their skin, because it's protective for their heart, it's protective for their brain. Yes.
Mm-hmm. And so now that you've come back to normal, and we look back at what has happened, is there anything by looking back that you're just like, oh yeah, that could have been a cue that was associated with my hormones? Or do you think you just had to go through the process that you went through in order to get to where you are now? Is it just about self-awareness, or is there something else?
Looking back, I do think perhaps there is a little bit of self-awareness that goes into it, and being a little bit more even in tune and attentive to the fact that, hold up, what's really happening and what is this change that's happening right now? And at least having it in the back of your mind that there's a possibility that this could be a hormonal imbalance or a hormonal issue that could be happening. For me, at the time, in the moment, I just didn't even want to think that that was a possibility, because I was like, but I was fine.
And is it because you felt that the effect wouldn't be this drastic, and you were
I didn't think, I honestly was even dismissing it for myself, though I do not do this for my patients, but certainly for myself, I was just like, no, how could it be this drastic? It can't be this drastic. It can't be this all of a sudden. I'm not having hot flashes, right? The hallmark of what we all think about. And granted, like I said, when I speak to my own patients, it's not like I'm like, oh, you're not having hot flashes, you can't be in perimenopause. Never, because when they describe to me what's happening, the fatigue, the joint pain, the fact that when they first get up, all of a sudden they feel like they're stiff, they can't move, and I'm like, that might be your hormones, the not sleeping. And I did have a little bit of that insomnia. Like I had a couple of other things happening, but I was totally ignoring them as the possibility in the combination of all the things that could be happening.
And it was really your friends in the medical field that pinpointed that. And I think that's an important point because
It was my business partners and assistants who work with me every day. They were like, you know, this is what this is, right? I was like, get out of here with that.
But I think it's important also because it means that even if it's not happening to us, if we see our girlfriends going through something like that, that we can say, you know, have you thought about this? Because we might not realize it ourselves. And I also think that even if you're an OBGYN, this is why I love this conversation, is, you know, even if therapists have therapists.
That's correct. And even the OBGYN needed an OBGYN.
Exactly.
I'm telling you right now, because I don't even know how to describe the level of frustration and anxiety that I was having with the possibility that I was losing my mind, and worse yet, not associating it with the thing that I really needed.
That you know so well, like the back of your hand.
I know, like the back of my hand. It was wild.
Okay, so now you go on hormones. 2 days later, you're feeling much better. You're just like, damn, that was it. That was it. So how are you feeling about yourself? You're just like, I should have known, or it's just like...
100%, the first thing I was like, what a dummy. Why didn't I figure this out? Why did I let myself suffer? Why did I go through that? Why?
So why do you think that is?
Because we're women. Because we're supposed to go through it, because we're supposed to grin and bear it, because we never think it's the thing. We blame ourselves.
Or we think we're crazy.
Or we really think that we are crazy. We're in hysteria.
Because that's what we've been taught.
Because that's what we've been taught through society and just through all of the imaging, the way that women are portrayed, even in this process, going through perimenopause and menopause, whether you look at it in TV shows or in videos, you know, but look at the face of perimenopause. I look at myself and I'm like, damn, I am sexy, smart, business oriented, like successful and young at heart. And in general, like I feel very vibrant. You know, this is not the perimenopause of the back in the day with, you know, full of gray hair and, you know, like the concept that you're like an old lady and no.
I also think that, you know, we talked about Adderall, we didn't talk about antidepressants, but the conversation about antidepressants is a much more, I guess, culturally accepted conversation to be had, more now than it was even like 10 years ago. But we're still not having the conversation of perimenopause in terms of hormones.
Perimenopause and hormones.
Exactly.
Like I think probably for half of the women, this is the time of their lives that they are first diagnosed with a mood disorder in the first place. Imagine that. They've never been told they have anxiety, depression. What I was going through, this extreme sense of like lack of control, focus, ADHD. Like I said, I've never been diagnosed with anything. But at the end of the day, I truly felt like that's where I belonged when that wasn't the case. I didn't need
belonged in terms of
a true
mental health
issue. And I'm not negating or disregarding women who have true mental health issues and that they need to have that kind of treatment, management of whatever is going on with them mentally. But the difference is we need to actually think about, could this be hormonal? It's not just, let me give this antidepressant or anti-anxiety, or in my case, some type of stimulant to help me with focus. That just wasn't what I needed.
For the women out there that are anywhere between the early 40s all the way down the line, post-menopause, the whole shebang, okay? can't focus, or you're having brain fog, or having some type of different sort of experience than you usually do when it comes to your brain, what should a woman do first?
First, I would say is acknowledge it. Acknowledge what's happening in your body and what's happening in your brain, and know that it's not because you're going crazy. I would say second, yes, talk to your provider, your doctor, your OBGYN, and say, I've never had these symptoms before, but this is what I'm feeling or what I'm going through.
Can they also say, could this be linked to my hormones?
I think they absolutely should point that out, because it doesn't mean that your physician is going to know automatically that this is what's going on, or that they're going to put two and two together or make that connection.
Or because hormones is sometimes a touchy subject, they might not even bring it up. They might just say you need to go see so-and-so. So
You're absolutely correct on that.
right? So it's good to bring it up for yourself. And it might be not related to hormones like it could, but at least you are raising that point.
You're raising up the question.
Yes.
You're raising up the point. Maybe you can have a hormone panel done that can help to delineate if that is in fact the case. The one problem I would say is when we're thinking about perimenopause is that in general medicine, we would do a hormone panel during perimenopause and everything would look fine. I think that's the hardest part, is that all of the levels would just come back and they'd be like, okay, well, your hormones are fine. Everything looks good. Okay. Nope, that's not what's going on, And so it is important to see someone who either is doing this kind of work or who at least is very sensitive and aware of the possibility that this could be what's going on, and then can kind of walk you through all of the different steps of what you can try to help relieve some of the symptoms, and then to see if at the end of the day, whatever you're going through all culminates at the end with perimenopause or, the menopause journey.
As women, we take a lot, right? We're able to take a lot. We're brought up in this system where we're conditioned to think certain things. And it goes back to a lot of the things we talk about in this podcast, is that you have to go back to yourself and be gentle with yourself and not beat yourself down that something is wrong with me, or I messed up, or I didn't do this, or I didn't do that. And actually say, well, maybe it's just my system is changing. And I think that we need to just alleviate that level of, we messed up.
Definitely.
What did we do? What did I do this time?
What did I do wrong? I ate too much sugar. Oh my God, that was the other thing. I was like, oh my God, I have to cut everything out. I cannot. It must be because of the M&Ms I ate. It was so wild.
The M&Ms?
I swear, I was like, clearly it's what I'm eating. That's what happened. That's why I'm like this. It was wild. I don't even know how else to put it.
I mean, and the reason why I'm saying this is from my personal experience. I'm 52. I just started in menopause, not like this year. And I had told you about it, that for a couple of times last year, I'm sharp. And so when I would do something, I just am very like clack, 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 1, 2, 3, 4, 5. And I guess it's called brain fog, but I never experienced that before. And so I thought, oh, is it because I ate something, or is it because my dad has passed away of Alzheimer's? Is it because now I have a brain tumor? Is it because, maybe I'm dehydrated, so I drank, I don't know, a liter of water? I was just like, something's wrong with me. There's something I did wrong, or my brain has gone completely in cahoots. And then I talked to you, and you're just like, that kind of sounds like brain fog. I'm like, really? It's that powerful? Like it can actually like not it makes me tired and not think. But then the important
But I told you that, right?
You did. You said, girl, that's brain fog. Like your girlfriends told you. You told me, girl, that is brain fog. I was like, really? My hormones are doing that to me? Wow, that's pretty amazing. But the important thing is the next time it happened, I'm pretty good with my menopause symptoms. It's not that severe. It happened maybe like 2-3 months later. I had that feeling again, and my default was, oh no, what happened? And then I go, oh, hold on. Oh my God, I think it's brain fog. And that was such a relief for me. I was just like, okay, I know what's going on. Okay, hormones, I see you. Check and check. We will come back to this very soon. But it was good to recognize it versus the other way. And also, if you don't know, you stress the hell out.
Girl.
And you are miserable.
I was so stressed. And I know better, and I was stressed. So I am here, honestly, we really needed to do this podcast because I said, if me, the girl who knows what's going on, could go through it, I have an even higher level, not only of respect for the patients that I treat and the things that they go through, but my level now of care, I feel is even more, is heightened.
I would say also it's a humbling experience, right?
And humbling to the max, right? I never put myself, let's say, above what, my patients can go through or try to think that, it can't happen to me, because I wasn't feeling like it can't happen to me. I just literally didn't recognize it. And yeah, humbling is a great word for how I feel now in terms of my ability to truly understand and empathize what's happening with my patients. And I had to do this, whether this is embarrassing, whether this is too much information. Sorry for the TMI, telling y'all I had my period, but I had to go through this. I had to share it with you. I had to share it with so many more of my actual friends and even my patients, because we're all human. There is nothing above human because I'm a doctor. I'm just someone who's here to try to help in this little time that we have here on earth. I'm so thankful of the work that I do and the women that I work with, that they were able to help me recognize something that I just wasn't seeing for myself. And they helped me get better. And I'm just thankful.
Thank you for your openness. Not everybody would be so open in sharing that, especially in OBGYN, dealing with OBGYN stuff. But I think it really shows the level of complexity and sometimes the level of layers that there is that we need to actually go through to really understand what it really is. And you just explaining that, it makes us all realize, if we don't see it too, like it's normal as well. We're all in this together.
We're just all in this together. We're all human. We're all going through human transitions. And at the end of the day, we always have to embrace our body and embrace ourselves. Until next time, thank you so much for listening to the Dr. Sophia ObGyn Podcast. See you later.
Bye.
Disclaimer. This is general medical information based on my professional opinion and experience. The content of this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay in obtaining medical advice for any medical condition they may have and should refer to their physician.